Oh! Holy shit!
Is that like your doctor's adjustments?
No. Oh, excuse my language, guys. Holy shit.
Your eyes are like watering up too.
Ooh. First name's Miko. I'm a chiropractor assistant. I also have a second job too.
Yeah, what do you do with that?
I work at a front desk at a resort.
Gotcha.
Where I'm from California. Can't say where, but
exactly. And she's trying to respect her doctor, and so again, if she tells me in the very beginning, she goes, "I don't want to say that he did nothing. I do feel better." But again, she wouldn't be here if he fixed her all the way. So she doesn't want to upset him, so I totally get it. So we're trying to keep him a little anonymous here. So I totally get it. But what I want you guys to understand is what the difference between my work and a, can't even say what he does, what kind of technique he does? You want to say that either? We won't say that. Upper cervical, though. He's an upper cervical specialist, okay? So she doesn't want you narrowing in on him, who he is. And so, and we don't want to disrespect him. And so, but we want to show you the difference between the Thayer method and upper cervical. And again, we're in the same realm of ideas here, so that's why she's here. She respects the idea of upper cervical. She just wants to see how the treatment is different. And I'm going to show you guys firsthand a chiropractic assistant who works in a chiropractic office and still works for him right now, how it's different. So this is going to be a powerful video. So Miko, why are you here? What are your symptoms?
Well, I'm here because...
What's the number one symptom? This is the interesting one for them.
The visual vertigo. I mean, the ringing in the ears, is hella annoying, and so is the dizziness and unbalancedness a little bit. The visual vertigo, it looks like things are kind of like moving a little bit still. And then also just, I said ringing in the ears already, right? Unbalancedness it's still there. I still feel like sometimes like I'm on a boat, but it's not that severe as before. So I still feel like I'm a work in progress, and that's why I want to see if maybe he can help me. Because by the end of the day, my health is more important, and I have to do whatever I can to help myself. So that's why I'm here.
Good. And I love this. She got a second job at this resort for why?
So that I can pay for treatment.
And she gets free treatment from her doctor.
Yeah. That's how serious it is.
Exactly. And so again, I'm not trying to badmouth him. It's just a different technique, and she is at her wit's end, because tell us how this started. It started from nothing. She had no tinnitus, no ringing in her ears, no visual vertigo. How long ago?
February this year, 2020. So literally, you guys, it could be small little things. I didn't even realize how small this is, but I was laying in bed. I was having a tantrum. I was having a bad day. And my dumbass decided to hit my head against the wall. And then literally 10 seconds later, I got tinnitus. And then I just started noticing after a month, I'm starting to feel like I'm on a boat. And then I start getting visual vertigo. And it's all because of that instance. So it's crazy, honestly. I had no idea that could happen.
I have one patient who had sleep deprivation for so long, he was yelling at his wife. His wife and him were in an argument. He threw himself out the car. He actually, in a moving car, threw himself out. I have a video on that, guys. Maybe I'll attach it at the end. But wow. He threw himself out of the car, and rolled on the road because his brain was he had not slept for 3 days. So tantrums, you may seem crazy. Why would she throw a tantrum? Why would she hit her head on the wall? But she did, because what happens is it's not just that she has tinnitus now or vertigo now. She's had problems for a long time. We were starting to talk about this in the exam. Yeah. And so she's had ear infections when she was a baby. She was a colicky baby. And so I told her, I think this goes way back, and she started bringing this stuff up. So I think this probably was a thing she was born with, and then she's been dealing with for a long time. And the hitting the head was a result of just exacerbation of what's going on. Okay. So nausea all the time.
Yeah.
Drunk person gait. I love that. What is that? You walk like you're drunk.
I feel drunk. I try not to walk like I'm drunk, but I feel drunk.
Now, she's spent a lot of money on medical quacks. You guys are out there. And if you're a medical quack, go ahead and sign in and say, you don't know anything about chiropractic or medicine, Dr. Thayer. I know everything. Well, you fix her, because this medical quack charged her how much money for this vestibular migraine diagnosis?
Yeah, so they're trying to figure out if I had vestibular migraines or maybe lymphatic hydrops. I went to a neurotologist. She happens to be like the top neurotologist in Newport. But anyway, they gave me this machine. It's like a balance machine, and basically they put like a metal thing in my ear, and it's supposed to measure if you're unbalanced or not, which it did, but I paid $2,000 for that.
No, $2,100.
Oh, well, 21. It was $2,100.
For an exam, And what happened? What was the result? Because obviously you paid the $2,100 because you're like, I'd like to get better, ma'am.
Yes. So I asked her, okay. She's like, well, you are unbalanced, so you have endolymphatic hydrops. I'm like, what is that? She's like, it just means you're unbalanced. And I'm like, okay, but what's the cause of it? Oh, it could be anything. It could be a virus. I'm like, wait, that doesn't really make sense. And they try to get me on Xanax and diuretics. And I'm sorry, guys, I've never needed any sort of medication in my life. So it seems strange that I all of a sudden want to give me anxiety, depression pills, and diuretics. I'm like, no, this is not the answer. There's no way. So I was like, deuces.
So I want to see, have you guys ever heard of this endolymphatic hydrops?
Or vestibular migraines.
Have you guys heard of this before? If you have, leave comments in the comment section because I want to hear about this because I've never heard of this endolymphatic hydrops. And so I find it funny. I'm now going to be treating that. Yeah, actually, you know, I'm all treating balance, and we'll see how she does after this. Okay, so tell us how the doctors you went to.
I went to an MD. I went to actually 2. I had to switch at 2 MDs. I went to 2 ENTs, and I still couldn't get an answer. So then I went to a neurologist who happens to be an ENT plus neurology in one. And I'm like, dude, like, they're not really doing
None of that
anything.
helped until she found this chiropractor that helped her. How did you find the chiropractor, by the way?
You know what? I went on Facebook groups and I talked to like probably 40, 50 people that had similar symptoms to me. So that went from like Lyme disease groups to vestibular migraines to vestibular neuritis groups. And there was just a few people that mentioned upper cervical. And I'm like, okay, well, at this point, I'm like at my wit's end. Like, I might as well try it because I can't deal with this anymore.
I love this girl. I love this girl. No wonder he hired her. After he started working on her, he goes, you want to work for me? And so now I don't know if she wanted to work for him for the free treatment or because she loves chiropractic or she needed a job. But she is very good, very well spoken, and you can tell that she's been through the ringer on this. So I think we've laid enough background here. Let's see, anything else? We have history of carpal tunnel, numbness in the fingers, low back pain in the past. She has some constipation, just more like having trouble to get started. A couple tiny minor falls, auto accidents, a bunch of tree falls. She used to climb around the trees a lot, maybe hit her head. But I think the ear infections is probably the thing that we need to look back at. Difficult breathing. Tell us about the difficult breathing.
I mean, I can't tell if it's allergies or sinus issues, but yeah, sometimes I just randomly, it feels like I'm having a panic attack. I'll be sitting in my car and I'm driving, all of a sudden it's hard to breathe. And I'm trying to check if it's like dust or something, but then I'm like, no, I feel like it's like hard for air to come through my heart and my lungs. So sometimes I get that. It used to be more frequent in the beginning of all of this, but it's kind of calmed down since I started working out. But still, it's still there sometimes. I don't know what it is.
Yeah. Anything else you want to share?
Yeah, you guys don't follow MDs. You guys,
I didn't say this.
I know a lot of you depend on westernized medicine, but I really implore everyone to think outside of that. You don't need a pill to fix all of this. Sometimes you need to go more of a holistic approach. So don't let anyone tell you that you have to depend on only your MD doctor because they don't always know everything. And it turns out that it applies to me because they're trying to get me to go on these pills. They really tried really hard to get me on these anxiety pills. And I'm just like, dude, I was normal before all of this, okay? So I want you guys to really just keep that in mind that you don't need to listen to your MD doctors, okay? Find something else.
I love this girl, I swear.
Yeah.
Now tilt your head to the left. How much tension in your neck?
About 3.
About 3. Tilt to the right now.
Like 3 or 4.
Gotcha. So we're going to test that afterwards. I hate doing that, but that's the test we're going to do. Now we're also going to test her hearing, which is equal right now.
Same.
Same? Gotcha. Now we're going to keep it quiet in here, so come closer.
About 2.
And we're testing her hair tinnitus. So she hears in her right ear a little bit more than her left ear, and it's about a 2 right now.
Right.
Okay, now we're going to test her vision. So she is looking at this chart right here. Okay, now you tell us, what does that chart look like?
Okay, so the chart looks like it's like moving. It's like almost like a dreamlike wave. It's doing this.
Okay.
It's very subtle.
Like this a little bit?
Slower.
Wow, okay, so cool.
Like that. Yeah, it's like that.
Okay. How long have you been dealing with that?
Since March 2020.
March 2020?
A month after I hit my head.
Gotcha. Okay, we can see our right occipital tilt here. The head's tilted to the right, and 15-degree scoliosis. Here we have 7-degree lumbar curve and constipation. Here is a pretty significant neck reversal at C3, really easy to see. And last one, sway back and constipation. Good, right there. This way.
Oh! Holy shit!
Is that like your doctor's adjustments?
No. Oh, excuse my language, guys. Holy
Your
shit.
eyes are like watering up too.
Ooh. I'm not exaggerating, I promise. Wow.
People are going to think you're exaggerating. So how is that different? Give them the idea or tell them what it feels like.
Precision. It's concise. It's
Oh, interesting. I appreciate that.
I can't describe it other than that. Which one did you adjust?
That was C3.
Wow.
And so you went to what kind of chiropractor then?
It was just a regular like
standard full spine
standard.
chiropractor,
Yeah, it's at the joint actually.
The joint?
Yeah.
Oh, we love those guys. I have, if you guys want to see my videos on that, I have playlists of those guys. They're really great doctors.
I mean, it temporarily gave me relief, but yeah, long term, the pain always came back.
So you've had several chiropractors work on you before?
So in total, you're the fourth.
Fourth.
Yes.
Gotcha. We call that body count.
Wow.
What? Chiropractic count, right? No?
Yeah.
Body count.
Got it.
Sorry. Sorry, bad joke. Watching too much TikTok. Can't let this go. Can't let this go here.
Oh, gosh! Wow. Was that C3?
C3, yeah. Maybe C4 a little on that side.
Okay.
Because I felt it when I was feeling your neck. I could feel the tension just a little bit lower. So I don't know if you felt me. I kind of dropped my finger a little bit.
Okay.
That was quite an adjustment. I think we've made some changes. And I can't wait to hear what's going on. But first I'm reminding her not to twist and turn or she will undo my work. You know, when you wiggle around, what you do is you call on muscle memory to actually go backwards in time. So we're trying to get her just to let my adjustments settle in. So let's listen into Miko and see how she's doing.
I feel there's a lot less pressure in a certain area. I mean, I didn't realize how much pressure I had.
Exactly. So when you tell me there's no pain, she tells me there's no pain, no pain, no pain. But she wouldn't be here if there wasn't some issues. The problem with her, this is why I knew it was an old issue, is because she has had issues for so long. Her pain threshold is way higher than most. Okay, just sending her down the hall to do a little recalibration. She is an athlete and she's flying. Okay, I'm curious, any of the vestibular stuff changed at all?
I'm looking really hard right now.
No, take a look, take your time.
Okay. I'm trying really hard to see if anything's moving. It doesn't look like it is right now. Hold on.
Yeah.
Okay. It seems like things are moving, not really moving as before.
See, she works for a chiropractor. She's a chiropractic assistant, and she still wants to disbelieve that I've helped her that fast because it's been going on for so long. How can this schmo chiropractor in Southern California help me so quickly? She can't believe it either. And she's trying.
I still feel like my equilibrium is off. It's still moving, but visually it looks like things are not moving as much. Like
yeah, that visual, that feeling of unbalance is your body actually improving. So when I treat you, what I'm doing is I'm changing your vestibular system, and that new balance feels odd at first. You have to get used to it. That's what you're feeling.
Okay.
Okay, stop. She's moving her head quickly around the room. She hasn't told me this yet, but she's moving it because she usually has this visual disturbance when she moves quickly. And so she's staring at things to see if she can recreate it, right?
Yeah. So there is a little movement, but it's
How much better, we'll say, just I'm curious.
Earlier, maybe it's like
60% better, 70% better, 20% better, where are you at?
I'd say about 30
30?
right now. Yeah.
Gotcha. And that's just because disbelief right now, guys. But it'll get better. She needs to sleep. Once she gets some sleep, her body will set, and we'll adjust her again in a couple hours, and we'll see how she does after that. Okay, so come closer. Good. Everybody quiet again. Let's listen to her ears.
Still there. Still 2.
Still 2?
Yeah.
Gotcha. Tinnitus is actually harder to get rid of, but we want to see where it is. We're documenting what's going on. So step back, please. Okay, tilt to the right now.
Like 3 or 4.
Gotcha. So,
Let's go 1.
other way. How much tension in your neck?
About 3. 2.
About 3. Tilt to the right. Gotcha. So half of what it was?
Yeah.
Gotcha.
About.
Okay, so anything else we checked? I think that was it. Oh, I'll check your hearing real quick. I'm only curious about this because usually tinnitus goes with hearing deficit sometimes. It's the same before, right?
Yeah.
Okay, good. So what do you think of your first experience with this adjustment system here?
Freaking awesome. I loved it. Oh my goodness. Shocking. I say maybe my body's still in shock.
Yeah.
And I'm still, just like
Processing
and just like hopefully, obviously the fear is it going to come back, right? For me right now, I'm just processing it and I'm enjoying it. So I appreciate it.
Yeah, no problem. So that's her first day. She's here for a 2-week program, guys. So by the time she's done here, we'll be going through Atlas work. We'll be doing through more balance work. We'll change her posture. So watch her posture, turns aside. See, look at how crappy this posture is, and she thinks it's awesome. And you guys will see the difference. I'll do a before and after on this one. This is awful posture, and you guys all think right now, people who haven't watched my channel before, that's good posture. But we're going to show you how bad it is, and she'll tell you how she feels after 2 weeks. 2 and 2. See you guys.
See ya.